Okay. Good afternoon or good morning, everyone. Welcome to the DSI Africa networking event. This is Breakout Room 2. I'm Inka Sastala. I'm a program officer here at NIH. Specifically, I'm at the National Institute for Allergy and Infectious Diseases. And I'm also the science officer for the DSI Africa Camera Research Hub, which focuses on combating antimicrobial resistance. And I'll be facilitating today's breakout session. This breakout session focuses on 3 training programs, specifically the DSSD, which is the NYU MOI Data Science for Social Determinants training program, the AFRIA DST, which is the Advancing Public Health Research in Eastern Africa through Data Science training program, and ENISA, which stands for Enhancing Data Science Capabilities and Tools for Health in East Africa. And we have 2 pre-recorded sessions, but I believe the presenters are here live as well. And we will get started with Miss Jessica, Jonas, and I'm sorry for mispronouncing. And as I said, this is a pre-recorded session. So if you have any questions during the talk, you can enter them in the chat, or we can get to the questions after the talk. Do we want to get started on the recording?
Hi everyone, I'm Jessica. I'm the program coordinator for the NYU MOI Data Science for Social Determinants training program, and I'm presenting today on behalf of our director, Dr. Rumi Chunara. Just want to give a brief overview of our entire team here. We have Dr. Anne Mwangi from Moi University, Dr. Judy Mangeni as well from Moi University, our wonderful co-program coordinator, Eileen. We have Dr. Joseph Hogan from Brown University, myself, as well as Dr. Vedanthan from the NYU Grossman School of Medicine. And last but certainly not least, Dr. Chunara, all the way on the right here. Just want to give a brief overview of our entire program, what it's about, what our goals are. I'll begin. So the DSSD training program is a collaboration between NYU, the NYU Grossman School of Medicine, Moi University in Kenya, as well as Brown University. And that is funded by the NIH DSI Africa Network, of course. And our main goals are to develop an MSc and PhD data science tracks at Moi University, which is currently in progress. And we hope to update people about that in the future. We also want to upskill and equip PhD students, postdocs, and faculty from Moi to teach classes and to do research. And I'm going to talk a little bit about the 3 trainees so far who have participated in this upskilling. And we also want to create short courses on machine learning and social determinants, which we've done 2 of so far, and we are currently planning a 3rd. And just as a main overall goal, we hope to infuse a focus on data science and social determinants throughout the entire program. So our first cohort consisted of Job and Philomena, who are pictured here. They came to NYU in spring 2023 and studied with us for about 6 months. They took various courses on machine learning and data analytics at NYU, at the Tandon School of Engineering, and at the School of Public Health. They also participated in mentored research and are currently working on their own projects. And we're actually excited to announce that when Job returned to Kenya, he was offered a job in the Division of Health Informatics in the Kenyan Health Ministry, which is amazing to hear. We're hoping to continue to work with him and work with the Kenyan Ministry of Health as well. Our most recent trainee was Samuel, who is a senior ICT planning and development officer of biomedical informatics at Moi. And he's actually back in Kenya now and working on a project aimed at improving health outcomes for diabetic patients by predicting the risk of their falling out of care plans and aggravating their diabetes. Moving on, I want to discuss our current workshops that we've had. In 2022, we had a virtual workshop attended by 16 trainees that focused on providing an introduction to social determinants of health and how to include them in data analysis and what specific challenges they could bring to quantitative analyses. And in 2023, we held our first in-person workshop in Eldoret, Kenya, which was attended by 44 trainees. And this format included lectures, hands-on statistical work, and it was focused mainly on machine learning, specific algorithms with that, and what real-world challenges can come up with machine learning. And from that 2023 workshop, we were able to create a community of practice, which focuses on elevating data science capacity in the African context while also creating data resources that we hope will inform models. And you can see here our current group, which formed in 2023. And we also want to mention that this social determinant community of practice was able to be created by a generous supplement award from the NIH, which we thank them for. And currently, the group has two ongoing activities: a scoping review group, which is working towards creating a scoping review to identify trends and gaps in current literature. That includes social determinant of health data in the region. Currently, we're focusing on Nigeria, Kenya, and Uganda as places of interest, but if collaborators are interested in working with us, we can definitely expand that to other countries. And we are also working on a data indexing group, which is working towards creating a repository of sub-Saharan African social determinant of health data from existing studies and surveys. And of course, if collaborators wish to work with us on that or have any other ideas of how to expand the community of practice that we've created, this would be an interesting thing to discuss. And lastly, I just wanted to discuss our workshop, which was planned for July 2024. We were going to focus on machine learning for real-world data. Currently, the workshop has been postponed, but we are planning to host it later in the year. We did accept approximately 80 participants with over 200 applications, which was an amazing boost compared to the first two workshops. And we're predicting, greater and greater interest each year. And we will give updates when we have ideas of when we're going to hold the workshop later this year. But we will have the social determinant community of practice convene during this workshop. And we do want to invite collaborators from many different organizations to observe or join us if they wish to. And we'll provide those details later. And if anyone has any questions, comments, or wishes to collaborate with us in any way, please feel free to reach out to Director Rumi Chunara or myself, and our emails are right here. Thank you.
Okay, thank you. Do we have so far any, I think, yeah, Jessica, you're also online, I see. That's perfect. So you can answer any questions that might come up. Do we have any questions at this time? Maybe while people still collect their thoughts, I can get started. So one question I have, so you mentioned you had in the 2023 and the 2024 cohort, I believe, so far 3 participants for the training program. How do you select those participants? Do you have specific criteria? Do they come, I'm assuming they come from within Moi University? How do you select who's going to come and visit and do the training on site?
Yeah, hi, that's a great question. So yes, you're correct that we do select either like postdocs or junior faculty from Moy University. And usually we have like an application, or we have one of our co-directors, Dr. N. Mongi, try to seek out people that they think have potential or people who could benefit from coming to New York and training with us. We try to look for people who maybe haven't had like experiences like that in the past, so that they can just breadthen their like knowledge and expand into different fields, and possibly, and the goal is for them to go back to Moy and teach in one of the MSc or PhD courses that we're trying to create. So it's kind of like this cyclical thing where we're just trying to recruit people who have potential and then train them, and then they can come back and train more people to try and build capacity in that way. And I see Pim Brewers has a question as well. I don't know if I pronounced your name right.
Yeah, no, whatever you say. So my question is basically, there are obviously a lot of science hubs around. So are you also interacting with the science hubs so that you can basically either train people in those hubs, or that you're using data from those hubs as as data for some of your trainees to further also the research at those research hubs?
Yeah, so that's a great question. In regards, and I think that kind of relates back to some of our workshops. We try to communicate with either our data hubs or other people that we've worked with in the past to find data sources that we can use to train people in our workshops. And we also, especially for those workshops, we really try to make them big events where we recruit tons of people, not just in Kenya or just at Moi University. We try to reach out as far as we can across the Africa hubs to recruit as many people as we can. And we've had people come from Nigeria and Uganda and a few other countries as well. But yes, we do use those data hubs as sources, especially for data and training purposes. And one of the most recent collaborations we had was with Ampath Kenya. And we can talk about that more, and like I could talk about that more over email. That was supposed to be, we were supposed to plan out like this whole thing for our 2024 workshop, which was unfortunately postponed. And I hope I can give some updates on that later. I don't have any information at this time. But yeah, hopefully that answered your question, Pim. And I see somebody else had a question in the comments about starting out in data science and still learning. What are the prerequisites to join the collaboration? So definitely for our workshops, we try to, like when we recruit for those, we try to find people who just have like a base knowledge of how to code in R Studio, so that they can just, follow along with the data analyses that we plan to do in those workshops. But you don't need, especially for those, you don't need to have like a super advanced data science skills. You just need to know how to do like basic coding in R, SAS, or something like that. But hopefully that answered your question.
Any other questions? Otherwise, we can move on to the next presentation, and we can come back for questions if we have time. At the end, we have 3 presentations today. So, and I guess this ends at 11. So we'll try to get to the presentations, and we can always have more questions at the end of the sessions when we have more time, hopefully. Our next presenter, and this is also a pre-recorded session, is Dr. Patrick Rieke from the Advancing Public Health Research in Eastern Africa through Data Science Training Program. And I'll see getting started.
Welcome to the AFREA DST project update being presented by Patrick Rieke on behalf of the other PIs, Kiros Berhane and Rahel Bekele, and the project manager, Aroka Morita. We will cover the introduction that will concentrate on project structure and aims. Then we'll discuss the project milestones, and here we'll concentrate mainly on the MSc training programs at both AAU and the University of Nairobi. Then we talk about the practicum and research immersion activities. We will also discuss the short-term training programs, workshops, and faculty development program. And lastly, talk about research groups. The structure of the program consists of 3 universities. The main PI, Professor Kiros Berhane, is at Columbia University, Mailman School of Public Health, and there are a number of departments and schools at Columbia University involved in the program. The other PI, Professor Rahel Bekele, is from the School of Information Science at Addis Ababa University, and the School of Public Health and Department of Statistics is also involved. The University of Nairobi is represented by Patrick Rieke from the School of Mathematics, but we also involve School of Public Health and School of Computing and Informatics. There are other stakeholders that we do collaborate with, governmental, mainly presented by Ministry of Health, non-governmental organizations, and of course the other academics, mainly from other universities and research institutions. The specific aims of the project are 7 in number. The first one is to develop and establish a new MS program in public health in the region. establish a faculty development program that will then promote sustainability of data science education in the region. The third one is to develop and deliver short courses on key areas of data science competency. The fourth one is to provide research immersion experience for the trainees. Fifth is to conduct a systematic, periodic program monitoring and evaluation for the project. Six, and this is something that we will do in year 5, is to explore feasibility of PhD program in public health data science. And lastly is to try to broaden this project to cover other areas, other universities in the region and also in our respective countries. These aims are summarized in this chart, and you can see there are 7 in number. The research partners and stakeholders are also listed. We also have targeted outcomes, the primary one being the new MS course that we hope will be sustainable, but also try to train faculty that and end up with impactful research. The secondary targeted outcome would be to have better public health practice in the region. What are the milestones involved? So the first thing that we did was to have the official launch of this program, and this was done in Nairobi in April 2022. We then developed through a number of activities the MS program in public health data science, and the curriculum, both curricula were approved at the University of Nairobi and Addis Ababa University in 2022 and 2023 respectively. After that, we enrolled the first cohort of the students at the University of Nairobi, and that was in February 2023. They were 15 in number, and they have gone through their training, and we expect them to graduate this year in September and December. Later, at the University of Nairobi, we enrolled the second cohort, September 2023. Addis Ababa started about a year later and enrolled the first cohort of students in October 2023, and there were 30 in number. They are now preparing to admit the second cohort this year in October 2024. We took a total of 8 trainees in the year 2022 and 2023 through the faculty development program. And this involved short training programs, especially in machine learning and SQL. And they had a visit at Columbia University where the training on research in data science continued. We have set up the training advisory committee that tries to advise the PIs on a number of activities that we do. We have also developed relationships with more data partners, and this has enabled us to be able to agree on how to get data for the students for their research. A very important activity that we have gone through was to cultivate practicum and internship opportunities for the MS trainees. And of course, a number of short-term trainings and workshops have also been organized. This is an example of students going through the practicum and research immersion activities. The first one on the left involves students who are attached at the GeoHealth Hub, and here they are monitoring how data is collected, data covering the air quality in Nairobi. Actually, And these students managed to get data as a result of these practicum activities for their research projects. The second one is a student attached to the SEMA going through the research synthesis activity, and she also did manage to get data from SEMA for her project. A number of short-term trainings and workshops have been organized for the benefit of both the students and staff. We have taken students through Python and R training other than what they cover in class. We organized a workshop for the project May 2023, and a number of areas were covered during the workshop, one being the pedagogical methods, the other one developing Shiny apps, and of course the last one was optimization tools in machine learning. This was followed by a second workshop organized in Mombasa, Kenya, this year, June 2022, with the theme on strengthening public health data science, training and research in the Eastern Africa region. And a number of topics were covered. And for this particular workshop, we had people attending physically and quite a number attended virtually. Here is an example of the 4 trainees that we took to the for faculty development for each of the years. So in total, we have trained 8 from Addis Ababa and from the University of Nairobi. This was a visit to Columbia University. We have started these research groups. There are a total of 4 research groups at Addis Ababa University and 5 research groups at the University of Nairobi. These research groups were started based on expertise of staff, the lecturers involved. We also then enroll students, depending on their interest, to be members of these research groups. This is a list of the PIs and their contacts and also the project manager. We encourage you to collaborate with them. Their contacts are given, and we've also given the Africa DST website. Thank you very much.
Thank you so much. And I think, Dr. Wake is also online, so he can answer any questions that come up. I don't see any in the chat yet. If you have a question, you can raise your hand and I'll call upon you, and I get to ask questions every single time, which is great. Dr. Wake, I was wondering, you first of all, it's great to see that efforts in expanding public health data science training efforts is happening. I'm a big advocate for that. And you mentioned internships that are, I guess, for the MS trainees at the institution, but you also mentioned that you develop and deliver short courses. And I'm wondering, are these shared with a wider community, which I guess would allow to expand beyond the AFRIA network? And if so, how do you advertise those workshops?
Thank you very much. I hope I can be heard.
Yes, I can hear you.
Oh, thank you. Yeah, so the short courses that we have developed are initially meant for the MS trainees, the staff who are involved in teaching the students, other staff members within the universities, Addis Ababa, and of course Nairobi. But we also have stakeholders from Ministry of Health, from research institutions, and from the other universities that we do collaborate with. So these are the people that we invite to attend. And of course, you realize that participation is limited. If you have too many people, it's really not effective. So those are the groups of people that we do send invitation to. And I can say that both University of Nairobi and Addis Ababa University have found it quite fruitful to get people from outside the university involved, and later on even help us to advise or supervise these students. Thank you very much. I hope that helps.
Yeah, thank you so much. Yes, it does. And we have another question in the chat. So the question is, where are the research hubs funded by, or were the research hub funded by the AFRIA DSI project or independently? And how are the students who register in these hubs funded?
The funding comes from NIH. This is a training program. The students have some limited support, partial support, but then there are also other students who come in into our programs and are supported by their employers. And there are others who are also, self-sponsored. So that is the kind of a sponsorship that we have for the project. And of course, the students, the MS students have from their employers and, self-sponsorship. Thank you.
Okay, I don't see any hands up. So maybe we'll continue to the last talk by Dr. Dan Masiga from the ENISA program, which is Enhancing Data Science Capability and Tools for Health in East Africa. And I believe this is a live presentation. Dr. Masiga?
There's actually a pre-recording, but I can do a live one.
Yeah, I don't have a pre-recording.
I have it, and
Oh,
I can pull it up.
Okay, thank you. Didn't want to put you on the spot here.
Actually, it won't play. It says the format is unsupported.
Okay, let me I'll find my live one. In a moment. Okay, Gifty, could you stop sharing your screen? Thank you.
We can see it. It's just not yet in presentation mode. Nope.
Hello, my name is Dan Masiga.
Sorry. Okay.
PI of the NASA Data Science Project, whose full title is Enhancing Data Science Capability and Tools for Health in East Africa. I will speak briefly about what we've done so far. ENESA is primarily a collaboration between ISIPE, where I am based, and my colleagues, Professors Amina Abubakar and Anthony Ngugi at Aga Khan University in Nairobi. And in our secretariat, we have Rose Marubu, who is a project manager. And ENESA also incorporates other members, other institutions, which are listed here, including University of Michigan, United States International University, USIU in Nairobi, Pwani University, the Ministry of Health, and we also collaborate with the Open Source Pharma Foundation in India. We have as our main goal to empower health personnel with data science and open science skills and tools in order to turn data into meaningful information that can contribute to health decision making. We have 3 aims: to develop a collaborative network in order to promote data science for health and also enhance career development. The second aim is to build awareness through various interactions with stakeholders, and I'll mention some of these. And then the third aim is to conduct training based on short courses, mentorship programs, and we want to bring in multiple stakeholders in the health sector, in the health ecosystem. This includes clinicians, researchers, trainers, postgraduate students, and so on. So just to highlight some of the activities we've had, one of the things that we've done is hold seminars. So we have the ENESA Data Science Seminar Series, and the first one was held in March this year, March 2024. And this was delivered by Dr. Ryan Nyoto, who is the head of the Division of Digital Health in Kenya's Ministry of Health. As shown here, there were 75 participants from 25 institutions based in 6 countries. And then the second one was by Professor Akbar Walji, one of our partners from the University of Michigan, who gave a seminar on data science for decision-making in health, highlighting some of the work he's doing at the hospital at the University of Michigan in applying data science to the internal medicine specialization that he has. But I want to refer a little bit to the first lecture by Dr. Nyoto. So Kenya has considerably enhanced digital health so that right from the community level, health information is transmitted or is captured and transmitted into the Kenya Health Information System, Kenya Health Informatics System. So that infrastructure that continues to be built is a huge resource for understanding various aspects of health if the data can be accessed and analyzed properly. And that's a contribution that we would like to make as ENESA Data Science. The Kenya's president visited the White House sometime this year, and the communique that was issued by the White House actually mentions DSI Africa as part of the partnership that exists between the 2 countries. So we can see that the need to build capacity and capability in this area is really urgent. So our project can contribute to that. So we have a number of training areas. This addresses aim 3, and this includes areas of data acquisition, organization and harmonization, analysis, and dissemination. And then the seminar series cover various areas. Two of them we've had already, as I've shown. But areas of governance, areas of equity. So these are areas where we would like to grow our partnership with other projects within DSI. So in the areas of ELSI, because we are running short courses, we'd also like to engage with others who are doing similar things in other areas or in other regions of Africa. Enesa's training model is based on short courses. And we know that there are training programs that have cohorts of students at postgraduate level that are delivered differently, but we can co-learn. We can learn from each other and get better as a program matures. So we currently have a residential training workshop going on with 30 participants. These are drawn from 4 countries, 5 institutions. This is 5 weeks in residence with the main theme of applying data science and machine learning in health. And part of this incorporates mini projects. So we've grouped the students into teams of 4 to 5. And there are 3 projects that they are working on, which they will report on at the end of the training later this week. So we have a team looking at spatial machine learning model for early preparedness for visceral leishmaniasis, one of the neglected tropical diseases that is a priority disease for WHO, and many governments, many countries in this region, in this East African region. Another group is looking at biological aging using characteristics in human characteristics such as DNA methylation. And then we have one team that is looking at using natural language processing to understand legislative gaps in disease management in Kenya. We really look forward to hearing the progress that they have made at the end of the training. We also have an internship program as part of our training, and currently have 4 interns who will be with us for 6 months. And we have 2 cohorts every year. So these 4 are in session. They're also participating in the residential training course workshop that is going on. And then we are looking forward to having a training next week that is, or in the next weeks, from the 12th of August, that is really focused on clinicians. So people who are either in clinical practice, either as medical doctors or clinical officers, in order to enhance their skills with application of data science. I just want to acknowledge the trainers that are contributing to the residential training. Who are shown here. There are others that are not listed here, and without these we wouldn't really manage. Let me also acknowledge our partnership with Uzima and the bioinformatics program, EMBIT, and funding from NIH with this grant award number, and of course DSI Africa. Thank you very much.
Great, thank you so much. What I forgot to mention, maybe if all of you, I think one person has done it already, if you could enter your contact email address in the chat. This way people don't have to go and find the presentation to be able to contact you after this event. Are there any questions? You can raise your hands in the chat. Raise your hands or type your questions in the chat. We have a few more minutes. So first of all, I have two comments and a question. First of all, I love the program's acronym now that I know what it means in Swahili. And second, it's also great to hear that DSI Africa is mentioned at the highest level. So that's really great news. So to my question, like you mentioned, there's so many different training areas across the spectrum of disciplines that are part of the program. And so I'm wondering, how do you select the topics for training workshops and the seminar series topics for your program?
That's a great question. So the topics for the seminars are selected basically by the steering committee, which is the key partners in each of the institutions, and we aim to deliver information about data science and data science capabilities to stakeholders, multiple stakeholders. And so each year we have 6 seminars. So you saw, the first one was just what is the infrastructure in Kenya for data science? And that is similar to other countries. For example, I think Rwanda has a similar model. They are much more advanced than we are. But and then the second one was just a question of how does data science translate to health decision making? So we are looking at presenting information to a community that is just coming into the data science space. And you can imagine that this infrastructure is being rolled out to a community, both health in the healthcare ecosystem, but also the general public that have no clue what data science is. So really just trying to inform and create awareness. That's the reason, the purpose for the seminar series. The courses are designed for specific groups. Like you saw, we have the clinicians workshop. So people in clinical practice are increasingly using electronic tools for managing patient data, but it hasn't always been like that. And how do we make the electronic data that they are using ready for data science tools, for computational analysis? So they will be introduced to things like RedCap and other data collection tools, really just trying to create an ecosystem where they can contribute to valuable data for analysis that can then be used for decision making. So we really try to tailor it to specific groups. And so that's why we have different models or different ways of delivering this through either workshops or internship programs. But we'll also have postgraduate students attached to specific projects. Yeah, thank you.
That's great. I see one question in the chat. Were the seminars recorded and are they available for viewing by the public?
Yes, they are. And I hope that they are available at this website. I'm going to just type in. Yeah.
That's great. And probably also, I'm assuming via the DSI Africa and NISA website. Oh, here we go. Yes, I see that.
Yeah.
Yeah. Are there any other questions? So one more I could think of thinking, so how can people collaborate with you if they are interested in doing so?
I think the best thing is to contact me or contact the project manager, and I'll put project manager's email in the chat.
Yeah, and how would you envision collaborations with other groups? I guess was really my question.
So yeah, so when I listen to the two groups, Afria and the one earlier, I was thinking, we are doing things, we are doing similar things in many ways, and maybe we should create a forum where we make each other aware of what we are doing, so that we can. Sometimes it may be possible to pool resources and have maybe a joint training or a joint event rather than having separate ones. I mean, there are areas where we do things that are distinct, but there are also areas where we are. Basically, the overall goal is similar across this what we've had this afternoon. So it'd be good to link up, especially if they're project managers or administrators that can begin to do that. I think that would be good.
There's already feedback in the chat. That's an excellent idea. We can do that, and I agree. I love the idea of cross-pollination across the programs. Are there any other questions in the chat? We're almost at time, so maybe one more if there's one. Otherwise, I want to thank all the speakers. This was really, really great. And I hope lots of collaborations come out of this, maybe joint training seminars or workshops. And I guess we'll see each other in the main room. And otherwise, I wish you all a great rest of the afternoon.
Thank you, Inka, and Gifty.
Thank you.